Welcome to episode 1, part B of module 5, heredity. We are continuing with inquiry question 1, how does reproduction ensure the continuity of a species? Our syllabus reference for this video, we will look at the features of fertilization, implantation, and hormonal control of pregnancy and birth in mammals. Learning intentions for today, we will outline the processes of fertilization and implantation and describe the function of key hormones involved in pregnancy and birth in mammals. Before we deep dive into fertilization, implantation, and hormones, it is important to understand the female menstrual cycle and the hormones that are involved in successful fertilization and implantation.
The female reproductive system consists of two fallopian tubes with an ovary on either side. Encasing the ovaries are the female gametes. These are the eggs. When a female is born, they are born with all the eggs they will need for their lifetime. Unlike males, we cannot produce more eggs down the track. In fact, as women reach the age of 30, there is usually a steady decline in ovarian reserve, to which a woman will enter menopause. Eggs are encased in fluid-filled sacs called follicles. Each month, one follicle becomes dominant and will release an egg. The uterus, or the womb, is where a developed fetus will occur. When a woman is due to give birth naturally, the cervix will dilate anywhere up to 10 centimetres to allow a woman to push a baby out from the uterus and down the vaginal tract. Now that we are a little bit familiar with the female reproductive system, let's look at how the menstrual cycle plays a role. On average, the female menstrual cycle is 28 days. Some women may be shorter, others may be longer. When we look at the average 28-day cycle, it is broken down into a couple of different phases. The first day or full day of a woman's period is known as day 1. On average, a female will menstruate anywhere between 3 to 7 days. Menstruation occurs when the lining of the uterus is shedding, resulting in blood and mucus expelling from the vagina. Between days 1 and 13 is known as the follicular phase. On day 1, follicles contained within your ovaries house immature eggs. During the follicular phase, one follicle will become dominant and the egg inside will get bigger and healthier than the rest. On day 14 is when ovulation occurs. This is when ovaries release a mature egg and it begins its journey through the fallopian tubes. Ovulation marks the end of the follicular phase and the beginning of the luteal phase. During the luteal phase, the dominant follicle that released the egg will change into a structure called the corpus luteum. This structure will produce important pregnancy hormones. Now we understand the reproductive system and menstrual cycle, we can begin to learn about the processes of fertilization and implantation. Between days 11 to 14 is when a woman is at her most fertile. If sperm is ejaculated into a female during this window, there is a high possibility of successful fertilization occurring. This is when a sperm and egg meet to form a structure called a zygote. Sperm ideally can live within the female's vagina for up to 3 days. Once a sperm has engaged with an egg in the fallopian tube, no more sperm will be able to fertilize the egg. Now you're probably wondering about how twins or triplets can occur. We'll explore this a little bit more in class. So upon successful fertilization is now the development of the zygote into an embryo. Over the next 5 days, the zygote will undergo cell division in the form of mitosis. By day 5, the embryo has developed into a blastocyst. Once at the blastocyst stage, the embryo will now need to implant. Implantation is when a blastocyst buries itself into the uterine wall. If implantation occurs, the cells continue to divide. Some cells will develop into a fetus and others will form the placenta. You begin to release hormones that will then signal positive pregnancy.
The key hormones involved in the menstrual cycle are FSH, the follicle stimulating hormone, LH, the luteinizing hormone, estrogen, progesterone, and human chorionic gonadotropin, or HCG hormone. Follicle stimulating hormone, as the name suggests, is involved in the follicular phase of the menstrual cycle. Its prime role is to stimulate the growth of one dominant follicle so an egg can mature and can be released during ovulation. The luteinizing hormone peaks on days 13 and 14 and triggers ovulation. Estrogen is the female dominant hormone that is secreted by the ovaries. In the lead up to ovulation, estrogen levels will rise and fall on the day of ovulation. And lastly, progesterone. This hormone lays dominant during the follicular phase and is triggered after ovulation. Successful fertilization and implantation will cause progesterone to surge. Progesterone plays an important role in maintaining pregnancy. If fertilization does not occur, progesterone levels will decrease.
And the last hormone we will look at in this episode is called the human chorionic gonadotropin, or commonly referred to as HCG. It is produced by the placenta during pregnancy. An at-home pregnancy test is designed to pick up the hormone and will confirm pregnancy as early as 3 days before a missed period. A more accurate and quantitative measure of HCG level is a blood test. Levels between 25 to 120 micrograms per mole indicate a successful pregnancy. HCG levels are often monitored in the early stages of pregnancy to ensure the embryo is viable. HCG stimulates the corpus luteum to produce more progesterone in order to maintain pregnancy.
And that is the end of episode 1, part B. Thank you for watching.